Back now live on MSNBC as states across the South and West try to get a handle on surging outbreaks. The Department of Veterans Affairs is reporting a large spike of patients within their system. According to the Military Times, the number of active coronavirus cases among VA patients tripled in June, with more than 4,100 active cases at 138 medical sites across the country. Joining me now is Jeremy Butler, the CEO of Iraq and Afghanistan Veterans of America. Jeremy, we appreciate your time. I just want to get your reaction and what you're hearing from members of the veterans community about the VA's response to the coronavirus and these new figures.
Yeah, the figures are certainly disconcerting. You know, in the beginning of the pandemic, not unlike the civilian population, a lot of the VA facilities that were seeing the highest numbers of the pandemic were on the East Coast, similar to the hotspots in the civilian community. And so I think maybe the VA was confident that as numbers got under control on the East Coast, they wouldn't see a rise out west and in some of the areas of the Midwest where the numbers had been low. Unfortunately, similarly to what we've seen in the civilian community, the numbers are really jumping everywhere, especially in the Midwest and the West, where perhaps folks haven't been taking as much precaution as they should around keeping themselves safe from this pandemic.
And I'm seeing some of this new reporting that department hospitals have a 30-day supply of PPE, but officials say that 6 months is what they're going to need to be prepared for the possibility of a surge going forward. Obviously, on one hand, you've got the sort of health crisis we're dealing with. The other one is the economic crisis. The veteran unemployment rate right now stands at, I think, just shy of 9%, like 8.6% or so in the latest unemployment report. It's lower than the overall number, which is more than 11%. But what has the situation been like for veterans in terms of their ability to hold on to their jobs or to potentially find work if they're looking for it right now?
Yeah, absolutely. And that number can be a little bit misleading because obviously that is a conglomeration of every veteran that's out there. What you see when you dig a little deeper is that the unemployment rate is actually higher than that number for the younger generation of veterans, primarily for those that served in the post-9/11 era. So for the younger generations that served, you know, in the time kind of after 2001, you see above 10%, approaching 11%, and probably going higher. This is something that we've been dealing and talking about and fighting against for a long time here. And a lot of that has to do with not just unemployment, but underemployment for a lot of these veterans. They're coming home, they're coming off active duty, and they're looking for a similar sort of challenge that they had when they were on active duty. They want leadership opportunities. They want to be able to bring the skills that they learned while serving our country to the civilian sector, and they're just not finding that as much. And I think a lot of that has to do with helping our civilian leaders in the industries understand how much our veterans can bring to their workforce.
And obviously that isolation caused by this pandemic, by these circumstances, can lead to anxiety and depression, which of course leads to the fears of additional suicides within the veteran community. I want to ask you about some new reporting that relates to America's troops, this generation of troops. The U.S. intelligence indicating that Russia was offering to pay cash on the deaths of American and coalition troops in Afghanistan. Your reaction to that? What are you hearing from other veterans and troops right now?
Yeah, definitely a lot of people very troubled about this. You know, we know that Russia can in many ways be our adversary out there, but when we hear reports like this, that there were real targeted attempts to kill and target U.S. service members overseas, that's really disconcerting. We know that there's always a risk when you're deploying, but what we want to know and make sure is, and that's that our government is doing everything possible to protect us from those risks. So I'd like to certainly see a lot more done there. But you touched on a number of issues that we're dealing with right now. It's not just Russian bounties to the Taliban. It's certainly the ongoing suicide crisis that we're dealing with. There's a lot that we're doing there. And it's also things more close to home, like the tragic murder of Specialist Vanessa Guillen at Fort Hood in Texas. There's just so much that we need to do to support our service members to make sure that they're not getting to the point of suicide, but also to make sure that we're responding to things like sexual assault and sexual harassment within our own forces. There's so much work that we need to be done, and there's a lot that we're working on Capitol Hill with our members of Congress, with the VA, with the Department of Defense, to really try and push them to tackle these problems head on.
And last thought, if I can, Jeremy, the number one thing that you think needs to be addressed right now by the federal government is what?
It's for a long time. IAVA members have been saying it's suicide. There's so much wrapped up there that really ties into every other issue that we're talking about: sexual assault, sexual harassment, unemployment, education benefit. All of that ties into the mental health of our service members and our veterans when they come home. So if we can really tackle the root causes of suicide, we're going to actually solve a lot more of the problems that we're dealing with in the country, both in and outside of the veteran and military communities.
We're grateful, of course, for the service of all those veterans who served in Iraq and Afghanistan, and frankly, all veterans across this country as we celebrate America's birthday. Jeremy Butler, we appreciate your time. Thanks for spending a little bit with us today. That'll do it for me right here on